morning, Muscatine. It is Wednesday, and the last time it looked like this, it absolutely poured on us during the show. There's supposedly, Chris, where's that storm at?
It's south of us.
Is it south? Is it staying down there? Okay, well, go out and have some fun then, enjoy it. Just try not to get caught out in the rain. Which actually, interestingly, and this is something that'll be in next week's paper, Iowa State University has created a new podcast about the weather. And it was so funny when I saw that come over, I'm like, who really wants to listen to a podcast about Iowa weather? But apparently it's a thing. So if my weather coverage for Muscatine isn't good enough for you, check out Iowa State's new weather Iowa. It must not be live. Like I don't know what it is. Go check it out. But anyway, that's your What's Weird in Podcast Today segment. This morning I have Christy Roby with me from UnityPoint Trinity Muscatine Public Health. Did I get all those right?
That was perfect.
It's like alphabet soup. How are you?
I'm very well, thank you.
So if you could, for everybody, just kind of introduce yourself a little bit if they may not know you, and then we're going to dive into back to school time because there is a bunch of stuff floating around out there.
There's a lot of stuff going on. So, Christy Roby, Director of the Trinity Muscatine Public Health Department. Unique partnership between our county, our Muscatine County Board of Health and the hospital. It's been going on since the early 90s.
Yep.
And so we deliver all of the essential public health services as a department of the hospital. I've been with the organization for July was 10 years.
Wow.
So, and I never knew public health existed. I never understood it until I got in the door 10 years ago, and I'm like, wow, this is phenomenal.
It is. Public health is such a, I'm going to say weird concept, but what I mean by that is it's weird in the fact that it fills all these unusual holes in systems, right?
You said that perfectly. That is exactly what we do.
There's no set battle plan almost, right?
Yep.
I remember when COVID hit, you guys stepped up, of course, obviously nobody entirely knew what their role was when COVID hit, right?
Yep.
But you guys were right there, because when there was stuff going on at some of the nursing homes, I'd call you and be like, is this a thing? We're hearing this. And obviously I knew you couldn't say a ton, but it was
yes.
Is this we're always trying to balance that, a person's privacy versus safety and but whatever. But you guys, again, just kind of stepped in and filled that role. And some of the things that we were talking about before the show, to me, are very much that kind of a thing. So
yes.
And we'll touch on those in just a minute. But I think the most important thing that we want to make sure we cover is the back to school health screenings.
Yes.
And so let's talk about that. What's a screening? How's that different than, normal appointments? And where do they go? What do they do?
Yeah.
What's it look like?
So we're hosting, this is our second, we're going to continue doing it every year, so we're kind of celebrating that. This is our second annual back to school health screening clinic that we're offering. Anybody can come that has children ready to go into school from birth to 18. And screenings are just kind of some of those basic things that are required to go back to school, which are some oral health screenings, vision screenings are required to go back to school. Lead screenings are required for young children to enter school.
We're going to put the lead conversation on the shelf for a little bit because we're going to come back to that just a little bit.
That's a big one.
So, yeah.
And so those are all the screenings that are kind of required, and we deliver those services out of our department. And vision screenings is something we're partnering with another organization to deliver again. So the other thing that we do is we do consultation because lots of immunizations are required to head back to school. And so we have nurses that will do a consultation to help parents understand what vaccines do they need to get. We're also going to have Dr. McKinney there, who is new with UnityPoint Health, and he's going to be there educating parents on the difference between a sports physical and really promoting adolescents having an annual wellness visit because it's more complete.
Yeah.
And a much deeper evaluation and assessment of the child's health.
We were talking about a little bit of that a couple weeks ago. Actually, it might have been a little bit more than that. Just the concept of having that annual, just like, when a kid's young, you have the well checks all the way through.
Yes.
And really, the way I just thought about it is, and I guess, our parenting world was so different when it comes to like the medical experience, right? But I just assumed there was like an annual well checky sort of a thing that you did anyway, right?
Right.
So it was kind of surprising to me that like not everybody kind of did it.
I think parents often are like, okay, we have to do these required immunizations. We're going to do that. Make sure our kiddos can stay in school. But you don't realize the adolescents, some of those start dropping off the required immunizations, and then parents are like, well, we don't have to take our kid every year, but it is highly recommended that you continue doing that. And if you have health insurance, it typically will cover an annual wellness visit versus having to pay out of pocket for a sports physical. So some folks have to.
Do annual wellness visits count as sports physicals?
The doctor will fill out your form for you, so you have a comprehensive health visit for your child, and they can complete that form that is required for the schools. And typically, not always, there's no out of pocket.
Okay, Muscatine, I don't rarely turn to the camera and tell you what to do. This is one of those times. I don't want to say skip the sports physical, but just do an annual check for your kids. If they haven't had one, call out, go to the health clinic, get set up with a provider, because I'm assuming you can help them with that.
Yes.
Just do it. And if you don't have insurance, so if you have insurance, it's an absolute no-brainer. If you don't have insurance, you guys can help direct them to things like Hawkeye and things like that as well. So like, if your kid hasn't seen a medical professional in a year or longer. And this is Chris advice. This isn't like official health advice. So like, don't suing me if whatever. If they haven't, call them, right?
It's that simple. Yes, it's that simple. And we will have navigators that day, as you just mentioned. We have an amazing workforce at Public Health, very talented, very knowledgeable, much more knowledgeable than I am in many facets. And connecting people to health insurance and a primary health care provider or doctor, and we connect people to all medical practices that are in our area. Because our public health department sits in UnityPoint Health, we don't just connect people to UnityPoint. Our job is population health, Muscatine County residents. So we work closely with University of Iowa, Mercy, Community Health Center, and UnityPoint Health Clinic. We have a lot of healthcare providers in our county. So we collect and connect the dots for individuals. We'll get them connected. And when you just mentioned Hawkeye, it made me want to share, a lot of times parents have insurance through their employer. Dental insurance is subpar through a lot of employers, but they can get Hawkeye. They may qualify for Hawkeye even just for the dental insurance piece.
Oh, I didn't know that. I didn't know you could
they could get just dental. Yes.
That's actually.
So we want folks to call us, stop in, ask about that. Hey, do I qualify? Our team members will walk you through that.
Yep. And that's, again, Muscatine, I try not to tell you what to do, just give you information, let you make your own decisions, right? But here's one, again, I'm going to go out. If you're sitting at home watching this and you're going, you know what, I'm not sure about this, maybe not, I don't feel like I have my health care or my kids' health care like locked down and know what's going on, call them. And if you're watching your senior, I know we're talking about, reach out to SHIP, reach out to all those resources, because healthcare is one. If you're on it and you're paying attention, you'll have a great experience, because you can be an engaged healthcare consumer and know your health and know what's going on. And it's nothing to be afraid. It can be complicated, it can be complex, but it's something you can handle, right? Like, so just pick up the phone, take that first step. The first step's always the hardest. Make that, get going, and 6 months from now, you'll be much happier.
Yes.
So that's my soapbox for the day. I'll stop now, I promise. Maybe.
Well, I also wanted to share that Race is a nurse at our hospital, nurse manager, supervisor, lead. He does it all at the hospital, and he will be present along with Angie Copy, and they will be doing education on concussion preventions, especially with sports coming up and kids on bikes and helmets. And some of our giveaway baskets, we're gonna have door prizes, and we'll have helmets in there for
Nice.
families. So we did that last year, and it was fun to be able to draw names at the end. Then next week we took it and delivered it to folks' homes. So we want to encourage that, incentivize, participation.
And real quick, if you don't win one of the helmets there, quick shout out for our sponsor, Harper's.
Yes.
Swing down, see Greg. He's
Phenomenal.
amazing at it, and he'll make sure that you get a helmet one way or another. So
He's all about prevention.
he is all about
Yes.
prevention,
And
absolutely.
he will help you. I've been in there before. He helps make sure the helmet fits right,
Oh, yeah.
secure.
Oh yeah, dude.
So-
Yeah, there's a reason he's like King Ragbri, everything. There is a reason, guys. He is absolutely a gem in this town. So
Yes.
take advantage of it. That didn't sound right. Don't take advantage of Greg.
Right?
Go avail yourself of Greg. Yes. Choosing your words wisely is not something I always do. But so we've got the back to school function. And one thing that you touched on there was lead. And so let's talk about lead just a little bit, because as we were talking before the show, it sort of caught me off guard. Like, I'm used to like, okay, lead, I mean, yes, I know lead's a thing. Don't go eat old paint, right?
Right.
But it's significantly more than that.
Yes. So as I mentioned, the services we're offering are dental, vision screening, and blood lead screening. So it's just a little poke of the finger of the kiddo. They have to be under the age of 6, is our focus. We did a needs assessment gap. We're assessing what the needs are, what you said earlier. What are the gaps in community? And in our last health needs assessment in 2021, there was data that showed the rate of children going to get tested for lead is very low. We're
Okay.
much lower than the state of Iowa.
Okay.
And those that are getting tested, their lead levels are higher than the state of Iowa. And so our job,
That's like a double-edged sword.
it is. So we've
'Cause
got kiddos
there's-
that aren't getting screened.
Right.
And those that are getting screened are at high lead levels. So we want to bring awareness to
Right.
all of that.
So it
Get
would stand to
screening,
reason
get
that
lead
there's
testing.
kids floating out there not being screened that have too much lead in their systems.
Yes. And if you get the lead testing done and it's in a higher range, truly any level higher than a 0 is too high. However, the CDC, they're saying, 3 or higher, 5 or higher, that's when you start interventions, but we say at any level, truly.
Okay.
You want to start talking to a nutritionist, your primary health care provider. How do we get these lead levels down? Because it can be managed and reduced through nutrition. So
Yeah.
it's so important, as you just mentioned, the annual wellness visits.
It's chelation is what it's called.
Yes.
That's how you get lead. I was just seeing if there's, wash your hands frequently.
Yes,
Make sure you're not eating lead accidentally.
yes.
Like-
And that's, kiddos can consume it. It could be, we have old homes in Muscatine County.
Yep.
Paint can fall into the foundation around the house if kids are outside playing. If their parents work in an industry where lead is part of the environment, they can track it home.
If your dad's a fisherman and there's a bunch of real lead weights hanging around the garage,
I remember helping my dad make those.
yeah, like melt it down, pour it in the mold.
Yes,
Yeah. Uh-huh.
yeah, yep.
That's that Gen X
So-
thing. We survived everything.
we did.
We don't need anything. We just need sunlight and a door to get kicked out of at 8 in the morning.
A lot of us probably, as we were talking earlier, had some high lead levels in us, and didn't even realize it.
Right.
So the importance, if a kiddo has extremely high blood lead levels, it can cause impact intellectual development in a child. So that's why we want to do the screenings and get the care they need.
Yeah, and looking at this, by no means, this was literally just get lead out of your body, quick Google search, folks. But like, it doesn't look like it's extremely difficult to help mitigate it. Just looking at this really quickly. I mean, it's conscious, you have to do it, but it's not like they're putting you on a dialysis to filter it out or anything like that. So,
Yep. It can be done with your medical provider.
Yep.
And nutrition therapy. So
Yeah, that's awesome.
Yeah.
Well, I mean, I am sticking my foot in my mouth
I
so
knew what
well
you meant.
today. So Wow. Okay, so one thing that we also want to make sure that we talk about is I think we've kind of got like the kids sort of handled, right? Like that. So if you're a parent, kids, go get screened, get your primary care provider set up, all that stuff.
Yes. I did want to add one more thing.
Absolutely.
So incentive to get parents to join.
Yeah. Sorry. Yes.
United Way will be there with us partnering again this year. And they are giving out backpacks to kiddos.
That's right. Yeah.
I'm so sorry. I wanted to make sure I mentioned that.
No.
And last year when kiddos would come, parents would give them their backpack. They wore that through the entire clinic, so proud and like showing it up. So appreciate United Way's partnership and being present and giving that resource to kiddos.
Yeah, and actually Hillary was here, was that last week, Chris, I think, talking about that.
So
It
fabulous.
didn't even dawn on me that this is, we're talking about the same clinic again,
Yes, yeah.
like, and again, that's one thing that I love about, Charlotte Schaefer was here yesterday and, or was it Monday, whatever. The community has gotten really good at working together.
Yes.
And as we talked, it wasn't always that way. And I think that role that like you guys play, the Community Foundation, United Way, I think everybody's kind of de-siloed a little bit and worked into that more nebulous but in your lane thing where you can extend into the gaps
Yes.
a lot better rather than saying this is what we're going to do. We're going to evaluate what's going on and react to it.
Yes.
And kudos to you and your team and all the others that have actually taken that step and made it happen because it does absolutely make a difference in the community.
Yeah, and I think kudos to Align Impact Muscatine as well, Kim Warren, because they have really led that collective impact model where we're the cohesive, the synergy, we're working together versus in those silos. So yeah, I definitely see the benefits of that happening for our community, our county residents.
Yeah, and it's something that's not necessarily like on a given day you can be like, oh yeah, that's the exact result of everybody working together. But often things like the new clinic and it's a different model for the community than what we've experienced, like say the last 10, 15 years or so is completely different than what it was prior.
Yes.
But it's working.
Yes, it is.
And I think people are starting to get used to it and I think actually appreciate it and learning how to work with it. So,
yeah.
Holy cow. So again, there's another little soapbox. Appreciate Muscatine, right?
Yes.
Okay, so let's kind of step out of that and let's go to the other end.
Okay.
I'm gonna go colon screening.
Colon screening.
I mean, because that's a thing.
It is a thing.
It's a thing.
It's not a sexy subject, right? It's not a fun subject, but it is part of our overall health. And oftentimes people don't want to talk about colon cancer screenings, colonoscopies. You'll see more, I think there's more awareness and support around breast cancer, right? And doing screenings there. But the colon cancer screening it's not as comfortable to talk about, I think, for us as a society. But it's so extremely important. If you can catch it early, your life expectancy goes up. I mean, it's so simple.
And again, folks, it's common sense. Like almost everything in healthcare, if you catch it early, you can fight it better. You can do whatever. I mean, like my dad had pancreatic cancer. They caught it fairly early, and he survived like just shy of 5 years, right? Because they were able to get it out and then monitor and whatever, right? And this is the same thing. Like, and it's funny on one hand, like, okay, colon cancer, on one hand, okay, maybe it is a little awkward to talk about, but really is it any more awkward than anything else? I mean, I've had a colonoscopy done. I mean, if you guys want, we could do like a poll. I know there was like Bob and Tom did colonoscopies on the air.
You should totally do that.
I'll tell you what, I will leave that to the people of Muscatine. If they really want to see me get a colonoscopy, we could probably figure it out at some point. But I'm hoping they really don't. But they're not that bad.
No.
I mean, you go to sleep, you wake up, you're done.
Yep.
You walk around and fart, and then you go home. I mean,
it's very true.
It's nothing that we don't all do on a normal day. Well, I mean,
it's bodily functions.
Yeah,
And this is a preventable
Yeah.
process to ensure we don't have cancer in our body.
yeah. And I mean, really, it's no different than cameras going. I mean, it's just, it's actually kind of neat in one way that they can do it that easily and make that big of a difference.
Yes,
Right?
yes. And so with the colon cancer, the colonoscopy is the ideal. Your primary health care provider is going to give you a referral to
Right.
do that at whatever age range, which they're dropping the age range on that as recommended to get one done. But public health collaborates with oncology and Gilda's Club to deliver colon cancer screening kits to the community. And these screening kits you can do at home. Again, not a glorious process, but we give you a little kit, even with gloves in it.
Yep.
You put this sample back in the little envelope. If you bring it back to our department, we actually give you gift cards. There's incentives in this grant.
You get gift cards
You get a
for
gift card to
doing
do
what
a
you're
colon
supposed
cancer
to.
screening.
Is it anything
You
like...
get paid. You get paid to do a colon
Now,
cancer
but see,
screening.
like, here's what I love about that. And I'm trying to find that silly cartoon guy that talks about colorectal cancer screening.
yes.
What is that from? I don't know.
It's a commercial.
It's a commercial.
Yes,
If you see
yeah.
the goofy guy talking about
Yes.
it, that's your cue to go.
But you can get that at Public Health. You can just come to our department, give us a call. We also
Right.
take these colon cancer screening kits out. We're doing lots of outreach during the summer. And our nurses provide the kit.
Yep.
And when the person returns it back to us, they get a gift card.
Cologuard. That's it.
Cologuard,
Yeah,
yeah,
you'll see
yeah.
commercials for it all the time. That's
Yes.
your cue. Call Public Health.
Yes.
I thought I had something smart to say there, but I guess I was wrong. And you can do it at home. Like, that's like,
Yes.
it's not like you go to the doctor, you go and, yeah, like you said, it's kind of a funky little process,
Yeah.
but it's, like, honestly, it's no different than collecting pee in a cup
Right.
when you think about it. Like, just do it, get over it, move on. Was there something else we wanted to talk about on the screening?
For that, I think it's ages 45 and older are the folks that we really are
Right.
trying to promote this colon cancer screening kit to.
So all of you out there that are a little bit older than me, that's you.
Yes,
I'm not quite there yet.
I'm there.
Sorry.
Which is why you want to do the screenings or colonoscopy. And the screening it really is truly simple. The colonoscopy is quite a process. It's not hard, it's not scary. It's just it's the prep the day before that takes a little bit of time,
But it takes some time, but here's the thing.
but it's worth it.
It's worth it, and you get a nice fresh start. Like, I'm sure we all know what we're talking about, right? We don't have to draw you pictures, but like, it isn't that bad.
It's not.
I mean,
Not at
it
all.
seems like it's like a lot of things, even people that are like on the show, they're like, oh my goodness, I'm so nervous. It's going to be such a big thing. And then when they're done, they're like, oh, that wasn't that bad. Right. And that's exactly what that is.
Yep.
It's not that bad. Just do it. So the other big note, DPP. I don't have any clue what that is that I'm supposed to. What is DPP?
DPP. Who doesn't have tons of acronyms, right? In their
Right.
whatever
Yeah.
their
Well, that's
field-
like normally,
Public
like,
health has
we
so
have like our
many.
little notes, and I'm like, I don't remember what.
DPP.
How am I not? And now watch. As soon as you say it, I'm gonna be like, yeah.
You
that's
are, because I spoke about it with Dr. Saga's last
Oh, yeah.
public speaking event. He partnered with us to help
Yeah.
us promote this program that we have. So we offer National Diabetes Prevention Program.
Yeah. Diabetes. Yeah. Diabetes.
Yes.
Yeah.
So we have preliminary recognition with the CDC to offer this program. So
Yep.
it's a diabetes prevention program. Again, back to our last health needs assessment, our mortality rates associated with diabetes between 2017 and that 2020 were off the charts. It was like 51. The rate was 51 out of 100,000 population is how they figured it. Extremely high mortality rates. We've got to get completely on the other side of that. So folks often are walking around with pre-diabetes and they don't even know it. If they can identify their risks, get involved in a program, this is an evidence-based program, demonstrates and shows the effectiveness. When you work with our certified life coaches, which are nurses also, so they have that additional skill set, you can reduce your risk of getting diabetes.
Yeah, and it's not overly difficult to make those adjustments. I mean, a lot of times it's just not being overtly trying to get it. Like, and that sounds bad, but like, stay away from the crazy exercise. Like, just be conscious about what you're doing, and don't just like grab the first thing, stuff it in your mouth. And that's going to get you a big chunk of the way there, especially if you've got support around you.
Yes.
And helping guide you to make those decisions. So it's not like you've got to go eat like, cups full of black beans or chia seeds and just start stuffing them down, and you're never going to eat anything good again, right?
Correct.
It's not that.
No.
It's just about balance.
It's about balance. It's about lifestyle changes in little increments, like Dr. Saga had talked about. And it's understanding and being aware, and you're receiving education while you're doing it, going through the program, and you have a network of people, as you mentioned. There's evidence behind that. If you have a group of people, it brings better health outcomes for people if you have that network.
This goes all the way back to blue zones. This goes back to the tribe concept. It goes back to, if you have that network, and here's the thing, if you don't, consciously build it, right? And this is the one thing that, sometimes people talk about, like Muscatine, oh, there's nothing to do, or there's, you move here and it's kind of cliquish or whatever. And all communities are like that to some point. But the one thing that I always remind people is, a lot of times you've got to take that first step and get out your front door, right? Like, things don't just come to you in a nice package with an engraved invitation, right? Like, you might find your tribe at a diabetes prevention, and it might not, you're not going to talk about just that all the time. You can like grow, and maybe you guys all start bowling together. You know what I mean? Like, there's so many other ways to build that, and then just having that other person who's like, are you sure you're doing what you know what I mean? Just like the polite check-ins and things like that make a big difference.
We all need accountability partners.
Yeah. And even, it's not like you have to like go, okay, we're going to be accountability partners and sign a contract.
Nope.
And like, they talk about in gyms, like if somebody goes to a gym, like a fitness class, 3.2 times a week or 2.3 times a week, the average length of their gym membership doubles, right? Because, and you think about it, it makes sense, because you're going Monday, Wednesday, Friday. You've built that tribe. That's your fitness class, is your tribe. It's who you are. It's, well, it's not who you are, but it's people that are like, hey, where were you, right? And that makes all the difference in the world.
It does. Humans have a natural desire to belong.
Yes,
and so when you have those communities and you have similar interests, it strengthens that belonging. And there are proven, as you just mentioned, blue zones. Oh, yeah. There are proven outcomes from that.
Yeah, I mean, it's almost like we need to, I don't want to say dust off blue zones again, but I mean, just kind of remind people, like, if you're out somewhere, and I know Hy-Vee has these, I'm trying to think of other places off the top of my head, but if you see like parking spots that are like lined with blue instead of white or yellow, I guess I don't know what color they normally are now that I think about it, but if they're blue, those are like blue zone spark, because you walk, it's like park a little further, walk a little bit further in.
Yes.
And that's one easy decision that you can make that just over time makes a difference.
Yes, yeah.
Smaller plates. I'm trying to remember all the blue zones. So,
smaller plates.
Go spend $50 and get rid of your 14-inch plates and get like the 9. You'll thank yourself later. Water, wine at 5 or something. There's like one glass of wine or something. More dark greens and colors, stuff like that. I mean, it's all stuff that we all know. Like, I would find it hard to believe that anybody sitting out there watching right now didn't know any of those things I just listed off.
Right.
Right. It's just what you do with it.
Yeah. Yep. And it's creating it and making it part of your lifestyle on an ongoing basis. If you decide to have a cheeseburger, you don't have to say, oh, well, I can't do it anymore. It's okay.
Yeah,
Just keep moving. Keep moving forward. You don't have to completely give up. One of the things that I struggle with is physical activity.
Right.
And walking. And the other day I'm like, okay, I was at my computer, 2:30, and I'm like, I need to get up and move. So I literally just walked around the Muscatine campus, came back to my office, and it was like, just, it's refreshing, and it gives your brain some energy.
Yeah.
And I have to force myself to do it because I don't enjoy exercise.
No, well, and like what's weird is like I enjoy like racquetball, like intense, like high intensity thing. Walking, you can ask my wife, I hate it. It's like, but, and like same for me, like I sit at my desk and thank goodness for my Fitbit because it reminds me get up and move a little bit.
Yep.
And do I necessarily get the whole 250? No, but I'll at least usually get up, stretch, move around a little bit so that at the end of the day I'm not like stiff and stuck, right? So find out what it is. And of course, my wife's got to be absolutely laughing at this. Yeah, eat those green vegetables, Chris. Yeah, because you do it, Chris. But just find the little things that work in your world.
Yes.
And that's the one thing that I think public health does really well is you guys provide those resources and you guys have such a, I'm going to call it cross-training function in who you are that if you don't know, you've probably got a little bit of experience with something or you know who does and you can pull it in and help act as that like navigator, you know, the connector feature. So again, if you have questions, just call public health. I mean, we talked about that when the new lactation specialist was on. You know, like if you have a question, just call. Like just call. Calls don't cost anything other than like your energy to dial. And you could probably ask Google or Siri to do it for you and you'd be fine.
Right.
Oh, hey, so if you're watching, hey Google, call public health. See if it works. See if anybody starts, see if your phone starts ringing off the hook. That happened with us with the Alexa once.
Oh my goodness.
The TV was on and it kicked off our Alexa because it was a, we'll see if it works. We'll see if it works.
Yeah.
I doubt it. I doubt it did. But anyway, holy cow.
Couple things I want to give a shout out to. So you just mentioned Rebecca Kirby is our new nurse practitioner, and she is also an international board certified lactation consultant.
Yes.
Which is, those are rare in Iowa, and so she has that on top of all of our reproductive and sexual health clinic services she can do for all genders. And it is World Breastfeeding Awareness Week and National Breastfeeding Awareness Month. So give Rebecca a call if you're a parent, you're trying to breastfeed, nurse, or you're going to and you need consultation, give her a call. She's phenomenal. And it's also Immunization Awareness Month. And so with this back to school screening clinic, and we're doing those consultations for parents and caregivers on what do your kiddos need to keep them safe from communicable diseases. Yeah,
and that's, you know, immunization is always such a fun topic, but, you know, if you can prevent something, why not? You know, that's about 99% of the battle, right? The science is there, it works. It's cut and dry. It really is. And that's, you know, even if you, for some reason, don't want to do it for you, do it for everybody else around you. You know, like, I know we had a conversation about masks early on and people were all worried about that. And the one thing that struck me was in Japan, prior to COVID, you would see people wearing masks if they thought they were sick because they didn't want to spread it, right? So, you know, here, you know, we might be more inclined to like, if you're sick, stay home, you know, rather than just, you know, and like, if you're sick, don't go to work. Like that's the last thing any employer really wants is like you bringing a communicable disease into, or, you know, virus or whatever, into the workplace where everybody else can get it, right? Like, just, again, it's just be conscious, be aware of those around you, and immunizations absolutely falls into that category.
Yes, yes.
So, holy cow, so much. One off the rails question for you.
Okay, oh boy.
Yeah, it's not that bad. If there was one thing about public health or, you know, that whole arena that you would want people to know that they might not, what do you think it would be? One thing that you think doesn't maybe get as much airplay as it should. I think we kind of nailed it actually probably with the colorectal thing. I mean, I think that's, I mean.
We just have so many different services there. If I'm going to talk about all the services, we have like 30 different service lines underneath the public health department roof.
There's that many? Like, I mean, I knew there was a lot,
Service,
but
yes.
I guess I didn't realize
Yes.
there was that many.
Yes. If you piece them apart, we have a lot of different services that we deliver. I would sum it up as give us a call if you have any questions.
Yeah.
But our focus is on health promotion, prevention of illness, injury, sickness, and protecting the health and well-being of the public.
Right.
That is our focus. So we're always assessing needs in the county for our entire population. We're not just city focused.
Right.
We're Muscatine County big picture. And then meeting the needs of those communities. So we just have so many services. We do early childhood developmental emotional screenings for kiddos.
Yep.
They're called ASQs. We do
What is ASQ?
ASQ, Ages and Stages questionnaire.
There you go. See this like. Now that one I didn't know. At least DPP, once you said diabetes prevention, like I'm right there. But
Yes.
That one I didn't know.
In the diabetes prevention program, one of the things we just did is we worked with 4 clinics. One was the Community Health Center, one was University of Iowa Hospital Clinics, and 2 were UnityPoint Health Clinics to change their policy and procedure to start doing pre-diabetes screenings for individuals starting at 18
Oh, wow.
versus 40.
Yeah.
And so we had, out of those 4 clinics, we had a data poll from those clinics, and we had identified about 6,000 individuals that are at risk for having diabetes.
Wow.
Based off of some of their health factors. And so that's why we decided to do the National Diabetes Prevention Program to get on the other side of diabetes. So we're always in that space of assessing what are gaps that we can fill, how can we support community?
And the really interesting thing, I'm going to make a really long tail connection here, but if you've been watching or listening to Dr. Saga at all, you know, the dementia he's got, I think it was, well, since January, he's been doing 1 a month, so let's call it 7, 8 presentations on dementia and how to prevent it and what the body's going through when it gets there and all that fun stuff. And the thing that he said probably 600 times, if he said it once, is dementia is almost type 3 diabetes, right? And it's all stuff that, you know, they're saying now the first early warning signs of dementia can be seen 20 years in advance. And I'm paraphrasing him. Go out to discovermuscatine.com. You can watch all of them. They're on PCTV. But if that doesn't tell you early on that paying attention to things like diabetes and your overall health makes sense, if like in some ways if you watch Dr. Saga and he doesn't scare the crap out of you, like in a polite way, and he's super nice about it, but like
He informed us and it made us go, wow.
Yeah, it's just like decisions you make when you're 18 to 40 do in fact affect what your life's like down the road, right? And and it's all manageable, and it can all, I don't want to say be reversed, don't get into medical stuff there, but like, you know, you can mitigate it, right? So there we go. That was a really interesting, what should people know? Use public health to not get dementia. Let's sum it up as that.
Right, okay.
How's that? That's it. UnityPoint, you heard it here, folks.
Or diabetes.
UnityPoint Public Health is going to prevent dementia in Muscatine. Right?
No.
No, that's not, oh.
Nope.
I thought that's
But
what I
Dr.
heard.
Saga did give us some amazing education for community members to learn how to
And if
reduce.
if you need that information, contact them, contact us. We can
Watch
get
the videos. Like,
Yeah,
I have gone back and watched. I didn't get to be I wasn't able to attend the first few of them, but was able to go back and watch them, and they're phenomenal.
They are.
So
It's.
thank you for airing it.
Oh, no problem. It's been fun, and it's fun to see. I don't know if fun's the right word. Such a engaged older community, right? Like the school district building was packed, and like the
Yes.
library was packed with people taking the initiative on their healthcare.
Yes.
And what they are and what they're doing, and that was funny. And so they're like, oh, thanks for doing that. I'm like, hey, if you guys are going to put this kind of effort into coming to learn about this, I think we can come point some cameras at it
Yes.
and make that work for you. So, so quick summary, because we covered a lot.
Yes.
You've got, when is the back to school clinic and where is it?
So it is next Tuesday, August 8th,
Mm-hmm.
at the Public Health Building, which is 1609 Cedar Street. We will have our upper
Which
level.
is the one like across from the hospital? No.
It
which,
is-
Which, because there's,
Yeah.
let's make sure people know which one it is.
Okay.
So if you're coming from downtown on Cedar Street,
Yep.
which one is it?
It is going to be on Cedar Street, is the second small brick building on the right.
Yeah, so it's right
you have to,
after, you don't go up into the hospital.
Correct.
It's the next one. It used to be Dr. Swayze's area.
Yes, yes.
Way back when.
Nancy
that's-
Kent Building, some
yes,
folks might
yep.
know it as that,
Yep.
from the Nancy
Yeah.
Kent Foundation. So, yeah, 1609 Cedar Street, we'll have the upper level parking lot all blocked off, lots of tables and activities set up for kids to participate in. And that, again, is from 12 p.m. to 7 p.m. We're really trying to be inclusive of different work schedules that caregivers might have. And we'll be doing the dental screening, so screening, fluoride for kiddos, and dental sealants that we'll be offering. That was a big hit last year. Vision Center will be there, offering vision screenings.
And little shout out to them, something kind of cool. Doing that, being part of the community, but I think it's next week. Dr. Schultz is coming on because it's their 50th anniversary. And, you know, it's that kind of a thing, you know, they do that stuff regularly. People may not
Yes.
always recognize it, right? But that's what keeps you around for 50 years. So,
Yes, and a huge shout out. Dr. Schultz is on our Board of Health,
Mm-hmm.
and we partnered together. He was able to give us a technician that can be present for this screening, free to the public, free to the folks that we're
Nice.
serving. And then they also will provide that vision screening form back to the parent, but they'll do a follow-up if there was any concerns for
Oh,
that
gotcha.
individual, and they can serve individuals that may have Medicaid insurance or no insurance and work with them on
That's awesome.
costs. So they're a phenomenal vision center.
And they do a great job of reminding you to come get your contacts when you constantly forget, like, say, me, who,
They
guys,
do.
I will stop out today and get mine, I promise.
They do take care of you though, like
They do,
family.
they do,
So,
yes, absolutely.
And then our nurses will be there offering the lead screening and education to caregivers. And again, we'll have Dr. McKinney there talking about the wellness, annual wellness visit for adolescents versus a sports physical. And Race will be talking about concussion prevention education, United Way giving out backpacks. So please come, bring
Next
your
Tuesday.
kiddos next Tuesday. Yep. You could, again, babies through age 18, bring your kiddos with you. I think last year we had 100 families come through. So 100 families that came through.
That's
and
awesome.
one person might have had one kiddo. I think one family had 6 children that they brought with them. So a variety of family sizes. We're there to serve, we're here to serve.
Awesome. Well, Christy, thank you as always. It's always so much fun talking with you because there's so much stuff that, like, you think you know, or like lead. I thought I kind of, no. It's a thing.
It is.
Take care of it. Just do your thing. So it's always fun. Thank you for doing what you do and your team. Thank you for coming on, and I'm sure we'll be doing it again soon.
Okay.
And holy cow, that's good.
Thanks for having me.
Oh, of course. Muscatine, don't forget, we will be back tomorrow, and go find something outside to do before